Welcome to the VDC Educational Webinars. I am Dr. Manisha Singh and I am heading the Department of Microbiology and Serology at Vijay Diagnostic Center. Today's topic for discussion is viral hepatitis markers. The speaker for the day is Dr. Vittal, who has vast 26 years of experience in the field of microbiology. He has done his UG from Gandhi Medical College and his PG from Usmania Medical College, respectively. He is working at VDC for around 11 years. Today, the discussion is on viral hepatitis marker, and I hand over the session to our senior consultant microbiologist, Dr. Vittal. Over to you, sir.
Thank you, ma'am. And good evening, Dr. Manisha Singh, for the great introduction. And now I am Dr. Vittal, who is speaking on hepatitis markers today. I'm working as a microbiologist in Vijay Diagnostic Center for the past 10 to 11 years. Now, let us start our topic of hepatitis markers. Now, hepatitis is a disease um, which has a considerable morbidity and mortality throughout the world. And there are many causes for hepatitis, like drug-induced hepatitis, infectious hepatitis, and autoimmune. There are many other causes, but the most important cause is infection caused by viruses. Now, hepatitis viruses are a heterogeneous group of viruses uh, which have a common property of hepatotropism, that is, causing primary infection of liver. Now, though they are a heterogeneous group, they are grouped as hepatitis viruses because of this common property, and they have been divided into 5 types. These are number one, type A, type B, type C, type D, and type E. All these viruses are RNA viruses except the most important of the group, type B, which is a DNA virus. Now, all these viruses, again, why we need hepatitis markers is an important point. And why is this? Because the viruses cause all these viruses cause a similar clinical illness, and the differentiation of which one is causing the disease is difficult. Hence, the serological as well as the molecular markers do help us for the diagnosis of the infection, knowing which virus is causing this disease in a particular patient. Now, let us talk about the individual viruses causing hepatitis. Now, the first one is type A hepatitis. The type A hepatitis is a globally distributed virus, mostly affecting children and young adults. And this is mostly seen, or the number of cases or the surge in the cases is seen in rainy season in India. The virus is spread by faeco-oral route due to contamination of water and food and all. And the incubation period of the virus is about 2 to 6 weeks. Usually, there are no symptoms, and after the incubation period, the patient remains asymptomatic. Now, but in some around 5% of cases, overt disease may be seen, and this has 2 stages. The clinical picture particularly has 2 stages. One is a pre-icteric stage, which has fever, nausea, anorexia, vomitings, etc. And all these symptoms subside during the icteric phase, which is the second phase of the disease. And this particular phase is characterized with jaundice. After this, usually the patient recovers in 4 to 6 weeks, though the recovery is a little slow, appears to be a little slow. Now, mortality in these viruses, in these diseases, is very low. That is due to hepatitis A virus is very low. It is about 0.1 to 1% only. In this particular disease, there are no chronic carriers, and perinatal transmission may be very rare, occasionally seen. That's it. Now, the most important part of diagnosing the hepatitis A virus is by two methods. That is, by the demonstration of a live viral particle or the antibody of the virus. Now, the, now the demonstration of the virus is by immunoelectron microscopy, which is done in the fecal extract during late incubation period or the pre-icteric stage of the disease. In these two stages, usually we can see the viral particle which can be seen under the electron microscope. As we know, electron microscopic procedures are very tedious and difficult. So the other methods and the easier methods which we can detect the disease caused by hepatitis A is by detection of the antibodies. The detection of IgM antibody in the blood indicates the recent infection due to hepatitis A, and the detection of IgG antibody in blood indicates either past infection, a past infection or immunity due to this virus. Now, the IgM antibody investigation is done by the chemiluminescent microparticle immunoassay technique, and the IgG also is done by the same technique, though other methods also are available. The CMIA technique is supposed to be more specific and sensitive. Now, the treatment part, as I told you, IgM antibody indicates recent infection and the IgG indicates either immunity or the past infection. Now, the treatment of the disease is only symptomatic, and bed rest is the usually that is what is advised to the patients till recovery, that is about 4 to 6 weeks. Now, the prevention is by good personal hygiene, as I told you, because the spread is through fecal-oral route. Good personal hygiene would prevent the disease to occur in a particular patient. Now, there's a vaccine available for prophylaxis of the virus, and usually immunity achieved is lifelong with 2 intramuscular doses of vaccine um, after 2 intramuscular doses of the vaccination. Okay, that is about hepatitis A virus and the disease caused by the hepatitis A. Now let us discuss the most important virus of the group, which is type B virus causing hepatitis. And the another unique property of this virus is this is the only DNA virus of all the hepatitis viruses. And this is transmitted through parenteral route. Most commonly in India, it is either through sexual contact or from blood and blood products, uh, perinatal, that is from mother to infected, HBsAg infected mother to baby. These are the most common routes, and in the Western countries, it could be due to sharing of needles and syringes in drug addicts, as well as homosexual transmissions, are common in Western countries. Now, after exposure, the incubation period is about 1 to 6 months, quite long. Now, as I told you, a clinical picture usually resembles that caused by other hepatitis viruses. But the particular infection with hepatitis B virus is usually more severe and prolonged. Again, the same pre-icteric and the icteric phases with the symptoms like vomiting, weight loss, nausea, and all with mild or moderate fever are seen in the pre-icteric phase. And once the icteric phase starts, jaundice shows up. Yeah. During the icteric phase, the pre-icteric symptoms gradually subside. And this in this particular disease, there are extra hepatic complications like arthralgia, polyarteritis, or glomerulonephritis, thrombocytopenia, and such extra hepatic complications are also seen to occur during the infection, and this may be this is attributed to the circulating immune complexes in the blood. Now, about 90% of the cases usually throw the virus out of their bodies within 1 to 2 months, and the total elimination of the virus and its antigens will take about 6 months from each patient who are not becoming chronic patients or chronic carriers of hepatitis B. The most important part of this viral infection is its chronicity, as well as the fulminant nature seen in few patients. Usually, another hepatitis virus, which is called a delta virus or hepatitis D virus, will be associated with HBV infections, and this association of hepatitis B as well as hepatitis D viruses may cause acute fulminant hepatitis in patients. Then, about 90% of the patients recover from the virus, as I told you, within 6 months of infection, but around 5 to 10% of them remain chronically infected and become carriers. A carrier in this particular case or in any case are as defined as those patients who test positive for hepatitis B surface antigen for more than 6 months after exposure. Now, before I explain the antigens which are seen in this particular infection released from the virus, let me explain about the carriers. This I'll also explain during antigens also. But now the carriers are two types. They are called either super carriers or simple carriers. This classification is based on their hepatitis B antigen envelope antigen titers. Hepatitis B envelope antigen titers. And there are about 400 million carriers around the world, with 45 to 50 million in India. Now, the super carriers, which I told you, are those carriers having high titers of the antigens released from the virus. These super carriers are highly infective also, and their association, that is their blood products, their secretions which we are exposed, if others are exposed, those people also may have a chance to get infected. And a very low dose of 0.00001 microliters of the antigen is enough for causing the infection in hepatitis B. Now, simple carriers are carriers who have low titers of the particular antigens which I have explained, that is hepatitis B surface antigen, the envelope antigen, as well as the viral DNA. Now, and one more most important property or the characteristic of this particular disease is one is the chronicity of hepatitis B, as well as the patients who become chronic carriers or the chronic hepatitis patients have the tendency to develop cirrhosis as well as hepatocellular carcinoma as the time passes on. Now, this much about the disease. Now, About the structure, as I told you, let me introduce you to the various antigens of the hepatitis B viral particle. The hepatitis B surface antigen, as it is marked in the diagram, that is the surface antigen which is on the surface of the virus. The other one is a nucleocapsid core which is inside the viral particle, and this particular one is called the core antigen, that is on the surface of the nucleocapsid inside. Now, the hepatitis B virus has got a DNA, and as I told you, this is a double stranded. One is plus, and the other one is a minus strand, and those are enclosed inside the viral particle. Now, there is an envelope antigen. Which is also called hepatitis B E antigen, located between hepatitis B virus surface and the core. As I told you, these are the antigens which are present in hepatitis B virus, as well as the immune response producing the antibodies against the viral antigens which which give protection to the particular patient who is infected. Now, after introducing these few antigens of the virus, let us go to the markers of hepatitis B in detail. Now, the first one, which I explained, the hepatitis B surface antigen, and this is also called the Australian antigen, as this was discovered by Dr. Bloomberg from Australia during 1968. So, hence, this is also called Australian antigen, and this is the first marker of hepatitis B viral infection seen in blood. And once when we test for hepatitis B antigen, and the positivity of this particular antigen indicates that the virus is present in the person's body or he is exposed. Now, this indicates acute infection of the patient. Now, as as the particular disease progresses, usually within 1 to 2 months the patients recover, but the whole process of total elimination of the virus maximum takes 6 months, and all the viruses are eliminated from the body and the patient fully recovers within 6 months. So, if the patient still tests positive even after 6 months of exposure, then it is a chronic infection and the patient may become a carrier. That is what is said here. Chronic infection. This particular antigen persists for several years or lifelong. Now, let us go to the second antigen. The antibody that is produced against hepatitis B surface antigen. This particular antigen is the neutralizing antigen, and this gives protection from infection to the patient. This appears usually after 6 months because the hepatitis B, for the elimination of the virus from the patient's blood, usually it takes 6 months. So this appears after clearance of acute infection, that is, the disappearance of HBs AG gives anti-HBs. Now, in chronic patients, the titers of anti-HBs AG may be very low or may not be there, and but usually anti-HBs is the antibody that is seen during vaccination. After vaccination of the patient, this particular antibody develops because this is the neutralizing antibody as well as the antibody that confers protection to the patient. Now, the value here given, anti-HBs titer more than 10 microliters per ml, is considered to be protective, and this particular value is after manual microwell ELISA technique. The other methods like alpha CMIA may give different titers for this particular antibody, which may also have a normal range. That is, the normal range differs from test to test. And this particular titer which I have given is for manual ELISA. This particular antibody persists for several years and gives or affords protection to the patient, but the titer may go down or wane off after a long time. Now, let us go to the other antigen or the third antigen, second antigen, which is a core antigen. This is an internal component of the virus, and it persists in the person's body as well as in the liver cells, and it can be demonstrated by immunofluorescence in the liver cells, but this is not released into the blood. Hence, this particular antigen cannot be tested for. Now, hepatitis B vaccination also gives anti-HBs antibodies, but not core antibodies. But the antibody that develops during this infection against this anti-HBC is um, seen during acute infection as well as in chronic patients also. Okay, and as I told you, this does not develop after immunization because this is not released into the blood, as well as the vaccine is which is given is only hepatitis B for surface antigen and its antibody, which is a protective antibody. Now, the anti-HBC is of two types, which may be an IgM or an IgG. Now, the IgM anti-HBC antibody appears after acute infection with the virus, and this is the first after hepatitis B surface antigen. This is the antibody which is produced against the virus in a particular patient, and this is the first antibody that appears during infection. And the IgM antibody which is present indicates recent or acute infection. In case of chronically infected patients, when there is an acute exacerbation of the infection, a low titer of this particular antibody may be detected, and at that time the clinical symptoms will give will give the diagnosis of either acute infection or chronic infection. Now, let us go to the IgG antibody or the total anti-HBC antibody. After the disappearance of the HBC IgM, that is the IgM antibody, the IgG antibody starts appearing. And this is the most constant marker of exposure. Usually after 6 months, this particular antibody is seen. Hence, this could be the diagnosis could be made as recent infection, or this may be due to a past infection. Now the total anti-HBC antibodies with negative HBC IgM in case of HBsAg indicates a resolved infection. Okay. Now let us go to the other and the most important antigen, which is called the hepatitis B envelope antigen, and we'll also discuss about the antibody. Now, this particular antigen is produced in the liver cells where there is active multiplication of the virus. Along with this, after multiplication of the virus, during the multiplication of the virus, this particular antibody is produced, antigen is produced, and this antigen also is secreted into the blood or the plasma of the patients. Usually, as this particular antigen is uh, coming into the plasma or the blood and getting detected, indicates a high viral load or the multiplication of the virus inside the body. Once there is a multiplication of the virus, this indicates high infectivity of the patient. So, the absence of this particular antibody, its absence indicates low viral load or because there is less multiplication or no multiplication, the DNA level also is very less. Sometimes this particular antibody, which may not be seen, but the anti-hepatitis E antibody may be seen in some patients with mutations. These mutations may be either escape mutations or pre-core mutations. In such cases, usually in case of pre-core mutations, this particular antibody may not be detectable in blood, but anti-HBG and anti-HB core IgM may be detected. So this particular antigen detection is very important, because the patients whose hepatitis B envelope antigen is positive indicates he has active multiplication of the virus inside his body, and his blood and blood products as well as his secretions, and when we are exposed to them, there is every chance that the other person may get infected. If the particular patient is a pregnant woman, and there is every chance that the baby which is going to be born may get infected through perinatal transmission. Now, anti-hepatitis B envelope antigen. This indicates host immune response against hepatitis B E antigen, and usually once this antibody appears, the viral replication is slowed down or not present, as well as the infectivity of the patient also is coming down. That is indicated by the anti-HBE antigen, that is anti-HBE antigen that is present in the patient. Now, the most sure test of hepatitis B is, besides these antigens as well as the antibodies which give acute as well as chronic infections and all, whether the presence of virus is very sure. We have to be very sure of the presence or absence of viral DNA in the patient is indicated by the RT-PCR test. And HBV DNA, which is tested in this particular test, is the direct and the accurate marker of hepatitis B viral replication. Now, serum levels of this seem to correlate with the risk of disease progression. Now, the viral load means this particular HBV DNA RT-PCR is of two types. One is a qualitative test and the other is a quantitative test. And the qualitative test indicates the presence or absence of the virus, and the quantitative test usually gives the viral load that is present in the patient, and this is useful for the treatment and the prognosis of the patient. Means that indicates whether the antiviral drug that is instituted to the patient, whether it is working or not, and the viral load is coming down or not, and the patient is improving or not. All these are indicated by the viral DNA. Now, these are the implications of the hepatitis B viral infection. In case of acute infection, this hepatitis B surface antigen is present for 6 months. The patient may be asymptomatic or may have acute viral hepatitis, and in few cases, it may be a fulminant hepatitis with acute liver failure. And case of chronic infection, which is more than 6 months with chronic hepatitis B, and a compensated cirrhosis or a decompensated cirrhosis may be seen, and after say 10 to 15 years, the patient may develop hepatocellular carcinoma. Now, the serological pattern of the acute HBV infection, here we can see this is within the first 24 weeks or the 6 months, that is HBsAg, which is going to a peak and coming down. Then after 3 to 4 weeks, it is anti-HBs, which is the protective antibody that is going to get a peak. And then the anti-Ig hepatitis B core antibody, that is we can see there is no core antigen that is seen in this graph. Now the anti-HBC IgM that is rising here, and this will be converted to IgG after 6 months. And we can see also during the first 20 weeks it is hepatitis B EAG or envelope antigen, as well as the anti-HBE antibody that is seen after 6 months. That is, the viral replication is stopped. This is the figure which gives us the details. Now this is the pattern which appears and where we can diagnose whether it is a chronic infection or an acute infection. So for acute infection to be diagnosed, I'll show you another. This is the chronic infection graph for the patients who have a chronic hepatitis B infection, which shows again hepatitis B surface antigen having a peak and continues to remain as positive. Then hepatitis B EAG, and for the first 6 months, then anti-HB EAG, which is seen here. Then comes total anti-HBC antibody, as well as now these HBsAg levels, which may be peaking up again, coming down again during acute exacerbations in the chronic patients. The HBsAg levels may be waning off and then peaking again. This particular picture shows whether is a chronic patient in the variations in the hepatitis B antigens during chronic infections. Now, this particular table gives us how to diagnose whether the patient is a chronic patient or an acute infection patient. Now, the first one is the patient. All of them are negative, and the patient is never exposed to hepatitis B infection. The other one is total antibody as well as the anti-HBs seen. So this shows the immunity achieved and cleared infection. This must be after 6 months. Now, the other one, total anti-HBC cleared, and anti-HBs has waned over time. Next, this is due to vaccination, the fourth one, and the fifth one is due to recent infection recovered. And the last two, these two indicate these are the two most important: hepatitis B present, total anti-HBs, anti-HBC also present, and IgM also is present, which indicates acute infection, which is present, and the other one indicates chronic infection. This is in this particular last stage. Though there is IgM antibody, this may be transient, and the clinical picture of the patient is more useful to diagnose whether it is an acute hepatitis or a chronic hepatitis. That much about the hepatitis B. And now to add a few more points, the prevention of the treatment part of hepatitis B, it is due to interferon as well as the antiviral drugs, which I have given you already, and the prognosis is monitored by the RT-PCR with the quantitative viral hepatitis B DNA, which indicates whether the patient is improving or not. Now, the prevention of the hepatitis B is by a vaccination which is available. The vaccine which is available is given in 3 doses. The first one is after 0 dose. The other one is after 1 month, and the third one is a booster dose after 6 months, which gives anti-HBs antibodies and adequate protection to the patient. Now, usually the pregnant women also can be vaccinated with this, as well as the children. Now, the prevention also is by screening of blood and blood products. Because it is a parental route of transmission, we have to reduce the number of transfusions required, and those which are given are to be given after thorough checking of the blood for hepatitis B infections. So this will prevent the spread of the disease. Now let us go to that much about hepatitis B. Now let us go to hepatitis C virus. The C virus, hepatitis C virus, is another RNA virus with an incubation period of 15 to 160 days. Most commonly, this also is similar to hepatitis B virus. Usually, the transmission is by parental routes. Most commonly, it is by transfusion of blood and blood products. And this is also called the post transfusion hepatitis. And as I told you, the clinical picture of all hepatitis viruses is similar, and this may be having an anecteric as well as overt illness may be seen. And the most important part of the hepatitis viruses is again the chronicity. These patients, most of the patients, progress to chronic infection. Some of them develop cirrhosis, and most also, and a quarter of them also develop to hepatocellular carcinoma. Now, after this, the hepatitis C virus is a highly mutable virus, and there may be changes in the genotype. So, the genotyping of hepatitis C virus is again very important, and there are 6 varieties of genotypes. That is 1, 2, 3, 4, 5, and 6. Most common genotype that is present in India is type 3, and the most common genotype in Western countries like America is type 1. Now, the worldwide distribution of this is about 200 million carriers, and transmission, as I told you, is by blood and blood products. Now, the standard methods for diagnosis of hepatitis B, usually most of them have got a card method for diagnosis, as well as hepatitis B as well as hepatitis C also. Now, the other method is by again chemiluminescent microparticle immunoassay technique. This gives whether the hepatitis C infection is present in the patient or not by testing the antibody. And now the viral load or the quantification of HCV RNA identification by HCV RNA RT-PCR is the most sensitive and the specific test. Again, as in hepatitis B virus, this by quantitative and qualitative methods, this gives whether the virus is present in the body or not, as well as the quantity of the viral particles, that is the viral load. And this particular disease also is treated with a vaccine as well as alpha interferon. Sorry, it's not the vaccine; it's the antiviral agents as well as alpha interferon. Okay. Now, the genotyping, which is the most important in diagnosis as well as the treatment, because few genotypes are difficult to treat and they need prolonged treatment. That is about 12 to 15 weeks, probably more than that. And type 1B as well as type 3 are the most difficult genotypes to treat. And the genotyping is more important because these two types are supposed to progress quickly. The disease progression is more, and there are every chances for the patient to progress to cirrhosis as well as hepatic failure. Now, there's no vaccine available for the hepatitis C also, and prevention is by reducing transfusions or thorough screening of the blood. Next is hepatitis D virus. D virus is only a defective RNA virus, as is shown in the diagram, and this is um, a defective virus which depends on hepatitis B for its replication as well as expression. So once it depends on the HBV, the transmission also is similar to that of hepatitis B virus. There are two types of HDV infection. One is co-infection, which is seen along with hepatitis B viral infection. And once there is a co-infection with hepatitis B, the chances of having a fulminant or acute hepatitis with fulminant hepatitis is more common in the patient. Now, the other one is a super infection, and in this, the patient with ongoing HBV infection may get HDV also, that is hepatitis E viral infection, and this leads to quick deterioration of hepatitis B infection. Okay, now chronic infection is again common in this, and these super infections also lead to hepatic failure. The most common cause for mortality in these cases is hepatic failure. There is no association of this particular virus with hepatocellular carcinoma. At least there is no study which gives its association with hepatocellular carcinoma. Now, treatment is again with interferon the virus. Now the diagnosis. Diagnosis is by HDV-RT PCR or HDV antigen. The antigen is demonstrated only in liver cells by immunofluorescence. Next is the antibody, the detected, again the IgG antibody or the IgM antibody is detected and indicate the presence or absence of the infection. Immunization. Now, the prevention of this particular viral disease is by hepatitis B viral vaccine because this is dependent on hepatitis B virus for its replication as well as infection, etc. Once HBV is prevented, HDV also is prevented, and hence hepatitis B vaccination is effective against HDV also. And all these are tests which are by the chemiluminescent microparticle immunoassays, ELISAs, RT-PCRs. All these tests are done in our institute. That is our Vijaya Diagnostic Center. Okay. Now let us go to hepatitis E virus. This virus is also transmitted through faeco-oral route, just like hepatitis A virus. Now, this again affects mainly young and middle-aged adults with incubation period ranging from 2 weeks to 9 weeks. Usually, as is common with other viruses, this also is a self-limited infection with low case fatality rate. But in case of pregnant women, from the equal the fatality or the mortality is very high, and that goes up to 20 to 40%. Hmm. The reason for the hepatitis E viral infection being more severe in pregnant women is thought to be due to the hormonal changes as well as the immunological changes seen in pregnant women. And that may be the reason why it is projected that that may be the reason why the pregnant woman has got have got more case fatality as well as mortality rate. Now, again, in this direction, in this infection, there are no carrier states observed. Again, as is seen in with hepatitis A virus, the diagnosis is performed by either demonstration of the viral particle by immunoelectron microscopy, which is a tedious and difficult procedure, and otherwise by the antibody testing of the blood of the patient for this infection. Again, IgM antibody testing can be done, and IgM antibody gives a recent infection, and IgG antibody indicates past infection. Again, these two are available in Vijaya Diagnostic Center, and IgM is performed by the chemiluminescent microparticle immunoassay, which is a specific and more sensitive assay, and IgG antibody test is performed by the ELISA technique that is available in here. Okay, now that much about the hepatitis markers as well as diagnosis of hepatitis viruses. Thank you.
Thank you, sir, for such a illuminating talk. To summarize, what I have to say is viral hepatitis are caused by 5 different types of viruses, of which, as it is monsoon season, we have to worry about hepatitis A and E, which is spread by the fecal-oral route. But the best part of it is self-limiting disease.
Yes.
Hepatitis B is can be, or if we get vaccinated, we won't have to worry about hepatitis B virus.
Yes. Yes.
Sir, there is one question for you from Ravikant. Can a HBsAg carrier patient take vaccine?
Yes, madam. Even usually there is no anti-HBsAg usually produced in hepatitis B. Then the reason for his being a carrier have to be checked, and then if the patient is um, fit for vaccination, I think we have to go for vaccination. Yes, he has to take all 3 doses along with the booster dose to be protective.
I think so. That is all from today's session. Thank you all. Thank you, sir, again.
Welcome. Bye. Bye, ma'am.
Bye, sir.
Pass, intena?